Okay, good afternoon, everybody, and a big thank you for joining us this afternoon. I'm Rachel Jannaway. I'm the Community Engagement Officer for HomeInstead, Swindon and Vale of White Horse. So for the next 15-20 minutes or so, keep it short and sweet if we can, we're going to have a look at dementia-friendly care in the community. Now, if you have any questions as we're going through, please use the chat facility. My colleague Sam Crew is on the call and she's monitoring the chat. She can respond to any specific questions and she also will be able to raise anything at the end if there's anything needed. She's put you a little note, hello everybody. So please feel free, use the chat facility. Sam is our Deputy Care Manager. She has many years of experience supporting individuals with dementia and their families and carers in the community, wealth of knowledge there. So we will now make a start. So I guess before we get any further, the thing we need to consider is what's care? What is dementia-friendly care in the community? Now, the Cambridge Dictionary states that care is to protect someone or something and provide the things that that person or thing needs. Now, care is a very, very personal thing, and what somebody wants or needs in terms of care varies very greatly, and there is no one right fit. You'll need to consider what's right for you, your family and your community at each stage of life. So the aim for today's session is to signpost some of the in the community, some of the organisations that can help you find that, and what sort of things you should be looking for to ensure that you and your loved ones get the right provision. So I'd like you to meet Fred. So Fred is being diagnosed with dementia. He lives with his wife, Anne. See them there, enjoying a nice cup of tea. So when I'm talking about an individual living with dementia, I will call them Fred. I will refer to Anne when I'm talking about family, unpaid carers and the loved ones of the individual. So as we know, and if you were on the session this morning with Kevin and Dementia Friends, a range of progressive conditions that affect the brain. So the type and levels of support that Fred is going to need are going to change over time, potentially. So the Cure the Care System video campaign that the Alzheimer's Society are running around this week highlights the thousands, probably millions of unpaid carers who look after loved ones at home and some of the issues that they face. Getting help and support for Fred and for Anne is one of the key factors in helping them both live well in their community. Most people don't want to talk about getting carers in. It's not something you want to consider, potentially. Perhaps it feels like, admitting defeat, giving up your independence. Or if you're somebody who is caring for a loved one, you might feel you've failed in some way. And we'd like to take this opportunity to reassure you, asking for some help is none of these things. In fact, just getting a small amount of help early on in the diagnosis can make a massive difference. So Fred and Anne should start thinking about what things somebody else can do for them that will make their life a bit easier and that will enhance their quality of life. So it might be having someone to help with trips to the doctor, the hospital, maybe someone to do the shopping, or take Fred to a lunch club or bowls or whatever. It could be some help in the house, in the garden, maybe just somebody to cut the lawn, or to provide a meal once or twice a week. But it could just be a bit of help with the technology. So Fred can Skype his grandchildren and Anne can join a virtual choir, or they can both join a Singing for the Brain group like we run. on a monthly basis. And as Fred's symptoms change, having some help perhaps with getting up, dressing, maybe more personal care, and taking his medication might just take the pressure off Anne, even if it's just a few times a week, or to keep her well and happy too. So, knowledge is power. Navigating the care path can be really confusing. So who can Fred and Anne turn to for knowledge? Unfortunately, typically when a care decision has to be made, it's made hastily because some sort of crisis has occurred. Now, many of our clients, and it's something we hear quite a lot, is they wish they'd have got some help in sooner and not waited until there was a crisis. Dementia care, in our experience, is far better if it's proactive rather than reactive. Many older people do fall ill indirectly because of things that happen at home. Maybe they're not eating properly, maybe there's some trip hazards, perhaps they're not taking their medication or missing GP appointments. And these changes in your health and well-being can cause someone to potentially be hospitalised and need urgent care. Now, I'd like to reiterate there is a huge amount of help and support out there and resources, but it can feel really daunting. So we would urge you to make use of a professional who knows what facilities are available in your local area. So I've put some examples up on the screen, but it might be your local GP, it could be the memory clinic, it could be one of the Admiral nurses, or perhaps you've got a Dementia Connect advisor from the Alzheimer's Society. There are also some really good self-help things online. For example, Alzheimer's Support Wiltshire have got something that is called the Dementia Roadmap and a support village, which guides you through different stages and points you to different resources that can be of help. Both which, Independent Age and many other publications have detailed web resources, and you can order them in paper if you prefer not to have the tech, and also in large print form. And there are companies like HomeInstead. You know, we are active in our local environment. We can provide free, no obligation consultations and advice. So please, I would urge you, make use of these local people. Don't wait until there's a crisis. It is far better to be proactive. As I said, knowledge really is power, and you aren't on your own. There is help out there. It can feel very isolating, and that's what we want to get over today, really, is there is good dementia-friendly care, and there are people who can help you get it. So be informed and know your options. I'm going to just talk briefly about person-centred care, because it's really important that we consider that when we're looking at dementia-friendly care. So, championed by a gentleman called Thomas Kitwood in the late 1980s, person-centred care is a way of providing care that focuses on the person's uniqueness, their preferences, and not the disease and perhaps the limitations and symptoms and challenges and the lost abilities. So Kitwood used a flower to demonstrate the psychological and emotional needs that need to be met for a person to remain well and happy. So it's really useful when you're considering what help and support that you or your loved one might need to think about those 5, 6 aspects and what else you could do to supplement your current living arrangements or caring arrangements to ensure the best outcomes. Person-centred care is recognising that dementia is only a diagnosis and there is a lot more to the person than that diagnosis. The way the Alzheimer's Society summarise person-centred care is it's treating the person with dignity and respect, understanding their history, lifestyle, culture, preferences, their likes, their dislikes, their hobbies, their interests. Then looking at the situation from the point of view of the individual with dementia. And these 2 points for me are the last 2 are the most important. Providing opportunities for the person to have conversations and relationships with other people, because people can become very withdrawn when they get a diagnosis, because they get either embarrassed or ashamed or just find things more difficult. And it's really important that they do have those opportunities to get out and do things and to have conversations with other people. And the final one is to ensure that the person has a chance to try new things or take part in activities that they enjoy. So dementia-friendly care in the community allows an individual to live well with dementia for as long as possible and remain connected and doing the things that they've enjoyed for as long as is appropriate. Hopefully you're all still with me. Nobody's dropped off yet, so you hopefully nobody's asleep either, because that's always a bit of a worry when you can't see anybody. So most dementia care in the community comes under the general umbrella of social care. And social care consists of services that support people with needs arising from illness, disability, old age or poverty. And social care includes things like domiciliary care, day centre provisions, as well as provision of equipment and housing options with varying levels of care. Social care is under massive pressure from lack of funding, and point to note, it is not free at the point of use, as is NHS healthcare. Hence why the Alzheimer's Society are really doing the campaign at the moment to make it free at the point of use, because it is a huge issue for individuals and their families. But how do you know what care you actually need? So as well as talking to the dementia specialists we referred to earlier, one of the key things that we recommend Fred and Anne do is to make contact with their local adult social care team. Now, as part of the Care Act, the local authority has an obligation to assess anyone for care and support needs. So while Fred and Anne at the moment might be coping very well and actually do have some funds to pay for private care, the authority has a duty to make an assessment of their needs, regardless of their personal financial circumstances, and to provide them with information about the services and the options that are available. And also they can offer Anne a carer's assessment as an unpaid informal family carer. As I've already mentioned, you know, it's better to be proactive than reactive, and with the stretched funding in local authorities, particularly now with COVID, you know, people, the more that people can be proactive and get in touch earlier, because these things can take a while to process as well. And so we want the local authority to at least have Fred and Anne on their radar to plan for the future. Now, while they may not be eligible for any state funding at present or at all, that assessment of needs can be really helpful, because it can point what help or assistance they could benefit from, and then Fred and Anne can consider what options that they want to actually take advantage of. Now, because of time, I'm only going to look at community support for Fred and Anne in their own home. I'm not going to touch on residential care. So what essentially are your options? So the first is sort of non-for-profit and voluntary organisations. So church groups, charities such as the Royal Voluntary Service, Age UK may provide support services in your local area. This might be befrienders, memory cafes, lunch clubs, day clubs, and some also provide help around the home, companionship and transport. Some of these services are free. Majority nowadays, there is a small charge, and it's not always less than a private agency, but it is worth getting in touch with those as sort of first point of call. Your next stage is probably a bit of home help. Might be just some help with basic household tasks, cleaning, gardening, home maintenance is all you need, and that can enable you to continue to live well and independently. Sort of moving on, home care agencies such as ourselves at HomeInstead, we employ professional carers and we manage the whole entire care service. Our services can start with, you know, just a bit of companionship, right up to live-in care and specialist care for palliative care if necessary. So that's another option. If you prefer to employ someone directly, you can hire a private individual, one or more, to help you with your private with your personal care, different aspects. And you may wish to consider an introductory agency to help you find and recruit some suitable private carers or a personal assistant. They do the background checks, and they may provide training, but this isn't necessarily always the case. Big thing to note, the carer is self-employed and works for you, and your family will need to take on those responsibilities of an employer. And your last option, which most people end up, it's kind of in tandem with the other options, is family and friends. So it may be possible, and they may want to provide help with your care needs or personal care, and it might be the solution itself, or as I said, it might supplement professional care. So how do you choose? How do you know? There are many guides out there detailing in step by step your different options. I've put a couple of examples on the screen. Both Wiltshire and Oxfordshire produce guides which are freely downloadable. I'll pop the links in the chat at the end of the session. And which has a very comprehensive online later life guide. And there are companies which specialise in finding care provision, such as Autumna and Care Choices. There's also the Society of Later Life Advisors, who can help with monetary advice as well as advice on care choices. But irrespective of that, all regulated care services are inspected by the Care Quality Commission on a regular basis, and you can search on their website and you can check out the prospective provider. You can read their latest report, and you can see how they're getting on and how they've been rated. And just a little sort of word of caution, some provision that is non-regulated, for example volunteer run groups, provisions such as day centres, may not be on these type of search engines, and that's where getting to know your local adult nurses, organisations like HomeInstead and the Dementia Advisors is really helpful, because they'll know what's available in your local area that is sort of more informal support, and how that organisation works, and how they support individuals living with dementia. But irrespective of your provider, the level of support, what type of provision it is, all good dementia-friendly care should be relationship-led and built on which we call our building blocks: respect, connection, communication, and trust. There are, again, freely downloadable checklists to help you choose the right provision. I'll put an example in the chat shortly on choosing the right home care package. But here are a couple of our sort of top tips. If it's a regulated organisation, particularly one if you're getting sort of home care, should be, what's their CQC rating? HomeInstead at Swindon, we're rated outstanding. What about the organisation's local reputation? Have a look at Google, have a look at homecare.co.uk, speak to your family, speak to your friends, speak to other people who use that service. Is the organisation active in your local community? Are they members of the local Dementia Action Alliance? Do they have local knowledge? Do they have local based staff? And what range of services do they offer? So for individuals like Fred, change can be quite upsetting. So having some consistency and the ability to flex up and flex down as your needs require is really important. So does the organisation just offer transport or just companionship, or actually could they provide a whole range of care, including perhaps personal care and living care if that's what is required in the future? And when it comes to their staff, how do they recruit them? What training and support is given for them? Are they trained in dementia care specifically? Are they signed up as dementia friends? Is there an on-call facility? Are there individuals mentored? All of these things are really useful in making sure you get the right care for you and for your loved ones. Now, as I said right at the outset, care is very personal, and choosing what is right for you and your family is a totally personal matter. There is a huge amount of dementia-friendly care available in your community, and Fred and Anne can remain independent in their own home if that is their choice. We at HomeInstead, we like to think we provide some of the best dementia-friendly care available. And why? Our services are rated outstanding by CQC. 96% of our clients recommend us. We have a rating of 9.7 out of 10 on homecare.co.uk. All of our caregivers they are handpicked, and they go through a rigorous training process. Our dementia care programme has been accredited by the City and Guilds. All our visits are a minimum of 1 hour, and the care we provide is specifically tailored to the individual. We are dementia champions, and we provide free advice and workshops to the community around living with dementia. We are founder and active members of the Swindon Dementia Action Alliance. We run free Singing for the Brain groups and support Highworth Forget Me Not Cafe and other community groups. We're a Playlist for Life help point. And our motto is to change the face of ageing and enable all of our community to live well their way. Thank you so much for listening.